Premature ovarian insufficiency, POI, also known as premature ovarian failure or early menopause, is a medical condition that affects the female reproductive system. It occurs when the ovaries stop functioning normally before the age of 40, leading to a decrease in the production of hormones like estrogen and a disruption in the menstrual cycle. This condition can result in infertility and various health issues due to the hormonal imbalances. In POI, the ovaries begin to dysfunction prematurely, leading to a decline in the production of these important hormones. While the exact cause is often not clear. Pathogenesis. The pathogenesis of premature ovarian insufficiency, POI, is complex and can be influenced by various factors. While the exact mechanisms are not always fully understood, several contributing factors have been identified that play a role in the development of POI. These factors include genetic, autoimmune, environmental, and iatrogenic, treatment-induced, influences. Causes of POI. Premature ovarian insufficiency, POI, can have multiple causes, and in many cases, the exact cause remains unclear. The condition involves a disruption in the normal function of the ovaries before the age of 40, leading to a decline in estrogen production and a potential cessation of ovarian activity. Here are some of the known and suspected causes of POI. 1. Genetic factors. 2. Autoimmune disorders. 3. Environmental factors. 4. Iatrogenic causes. 5. Chromosomal abnormalities. 6. Enzyme deficiencies. 7. Hormonal imbalances. 8. Infections and inflammatory conditions. 9. Unexplained cases. Sign and symptoms. The symptoms of POI can be similar to those experienced during natural menopause, but they occur earlier in life, usually before the age of 40. Here are some common signs and symptoms of POI. 1. Irregular or absent menstrual periods. 2. Hot flashes and night sweats. 3. Vaginal dryness. 4. Mood changes. 5. Fatigue. 6. Changes in libido. 7. Difficulty concentrating. 8. Infertility. 9. Bone health issues. 10. Cardiovascular health risks. 11. Changes in secondary sexual characteristics. 12. Premature aging signs. The severity and combination of symptoms can vary among individuals. Some women might experience only a few of these symptoms, while others might experience a more comprehensive range. If you suspect you have POI or are experiencing symptoms related to hormonal imbalances, it's recommended to consult a healthcare professional for proper evaluation, diagnosis, and management. Early diagnosis and appropriate treatment can help alleviate symptoms and mitigate potential long-term health risks. Diagnosis. The diagnosis of premature ovarian insufficiency, POI, involves a combination of clinical evaluation, medical history assessment, physical examination, and laboratory tests. Since POI can have a significant impact on a woman's reproductive and overall health, it's important to accurately diagnose the condition to provide appropriate management and support. Here's how POI is typically diagnosed. 1. Clinical assessment and medical history. 2. Physical examination. 3. Blood tests. Blood tests are crucial for evaluating hormone levels that can indicate ovarian function. The following hormone levels are typically measured. Follicle-stimulating hormone, FSH. Estradiol. Anti-Mullerian hormone, AMH, remaining follicles. Thyroid function tests. 4. Imaging studies, i.e. ultrasound. 5. Genetic testing. 6. Other investigations. Early diagnosis and management are important for addressing symptoms and potential health risks associated with POI. Risk factors to avoid. While some risk factors for premature ovarian insufficiency, POI, are beyond your control, there are certain lifestyle choices and actions you can take to potentially reduce your risk or minimize the impact of POI. Here are some risk factors and proactive steps you can consider. 1. Avoid smoking and secondhand smoke. 2. Manage stress. 3. Maintain a healthy weight. 4. Limit alcohol consumption. 5. Protect yourself from environmental toxins. 6. Discuss treatment risks, such as chemotherapy or radiation therapy. 7. Discuss fertility preservation options with your healthcare provider. 8. Regular checkups. 9. Genetic counseling. 10. Healthy lifestyle choices. Treatment options. Premature ovarian insufficiency, POI, is a condition that involves a decline in ovarian function and hormonal imbalances. While there is no cure for POI, there are several treatment options available to manage symptoms, improve quality of life, and address potential health risks. The choice of treatment depends on individual preferences, age, desire for fertility, and overall health. Here are some treatment approaches for POI. 1. Hormone replacement therapy, HRT. HRT involves taking estrogen and, if necessary, progesterone to replace the hormones that the ovaries are no longer producing adequately. This can alleviate many of the symptoms associated with low estrogen levels, such as hot flashes, vaginal dryness, and mood changes. It also helps protect against bone loss, osteoporosis, and cardiovascular risks associated with estrogen deficiency. 2. Calcium and vitamin D supplementation. To promote bone health, calcium and vitamin D supplements might be recommended, especially if you are taking hormone replacement therapy. 3. Fertility preservation and assisted reproductive techniques. If fertility preservation is a concern, options such as egg freezing, embryo freezing, or using donor eggs can be considered for women who wish to conceive. Assisted reproductive techniques like in vitro fertilization, IVF, using donor eggs can provide a chance of pregnancy for women with POI. 4. Psychological support. 5. Bone health measures. 6. Heart health measures. 7. Regular medical checkups. 8. Experimental treatments and clinical trials. Some experimental treatments are being explored to potentially stimulate the ovaries and restore ovarian function. These might involve the use of certain medications or stem cell therapies. Participation in clinical trials can provide access to innovative treatments under close medical supervision. Treatment decisions should consider factors such as symptom severity, desire for fertility, overall health, and potential risks associated with treatment options. Open communication with your healthcare provider and active involvement in your healthcare decisions can help you navigate the challenges posed by POI. Subscribe us to get updated from related content.